This is a case study about a man who experienced a radius and ulna fracture named Dimitre by Rachel Loudermilk and Phoebe Morales. Dimitre is a 92-year-old man who sustained a right distal radius and ulna fracture due to a fall in his bathroom. He's originally from Russia but moved to be closer to his two sons. Dimitre lives alone in a first-story apartment and was completely independent prior to his fall. Although he does not drive, he likes to walk daily, and he is very fond of his pet bird. While at the hospital, X-rays revealed that Dimitre experienced a clean fracture with no need for surgery to stabilize, so a cast was placed on his extremity. Regarding non-displaced fractures that occur at the distal radius and ulna, healing is typically accomplished by immobilizing the extremity with a cast, a splint, or a fracture brace. There are three phases of healing: the inflammation phase, the reparative phase, and the remodeling phase. Rehabilitation for this type of fracture typically begins as soon as the cast is in place. This helps to reduce the possibility of stiff joints, disuse atrophy, and muscle weakness. Dimitre is in the early consolidation phase, which is 6 to 8 weeks when the cast has been removed. Active use of the limb should be performed at this time as tolerated, and it should be done to perform functional tasks. Edema, sensibility, and pain should be assessed regularly, and his skin color and temperature should be assessed as well for circulation. Dimitri's strengths include that he is modified independent for ambulation, his cognition is intact, and he has no significant perceptual deficits. He is also independent in all transfers, his coordination for fine motor and dexterity are intact for his left upper extremity, and his gross motor coordination is within functional limits for his left upper extremity. With regard to his manual muscle testing grades, he is a 4 out of 5 in his left upper extremity and has full active range of motion. He's a 4 out of 5 for his right shoulder and a 3+ out of 5 for his elbow and his hand, meaning that he should be able to engage his right upper extremity when performing functional tasks. Other general strengths of Dimitre include that he is creative, excited for OT, he is an independent individual, he has neighbors who are willing to help him out, and he is also set up with social services transportation. Some of his weaknesses include that he has no family support, he has a difficult time accepting help from others, he lives alone and does not speak English well, he does not drive, and he is also right-hand dominant, which is the hand that suffered the fracture. Dimitre has multiple problem areas. He has decreased memory, which affects his ability to manage his medications. He has decreased sensation for sharp and dull in both hands. He has right hand numbness and tingling, especially in his fingers, and he experiences pain with most wrist movements in his right hand. His vision is poor in his right eye due to cataracts and macular degeneration. He also has edema in his right wrist and fingers. He does not have full active range of motion in his right upper extremity. He has impaired coordination for fine motor and dexterity in his right upper extremity, and his gross motor coordination for his right upper extremity is also mildly impaired due to decreased elbow active range of motion. His manual muscle testing grade for his right wrist is a 3- out of 5, meaning that he is not able to tolerate any resistance. Below are Dimitri's problems prioritized.
When conducting therapy, it's always important to take into account the big picture. Some things that need to be considered with treating Dimitre are if there's the presence of edema or pain or any discoloration of the hand, as this can indicate some kind of issue that is going on and therapy may not be appropriate at that time. He also has decreased sensation, so you need to be extra cautious when using hot or cold or applying pressure. Dimitre also has diabetes and congestive heart failure, and you need to be aware of what precautions there are with those. He has decreased vision and memory, so performing tasks he may need some extra assistance, and you may want to incorporate those items into your therapy for his hand. Last of all, he has just had his cast removed, so it's important to get him moving. Make sure that he's moving the hand, the fingers, the elbow, because we don't want him to develop contractures, but you do want to check with his physician to see how much resistance or force can be applied before addressing those in therapy. And also you might want to consider splinting for him so that he doesn't develop contractures. The following assessments would be appropriate for Dimitre: manual muscle testing, ROM, testing for edema, his grip strength, his pinch strength, sensation testing to see if he's recovering any sensation, vision, and also observing him performing functional tasks. From the problem list that was presented earlier, you can see there are many areas that could be focused on for Dimitre. However, because we are focusing on his wrist injury and we want him to become as independent as possible, we are focusing on his ADLs and his IADLs. Currently, Dimitre needs moderate assistance in order to complete showering. His long-term goal is to become modified independent in showering by discharge. We have selected short-term goals that will help us progress him to being modified independent, starting with the use of a long-handled sponge. However, we do want Dimitre to incorporate his right hand and to not lose function in it. So our short-term goals also incorporate him starting to use his right hand to retrieve soap and to wash his hair in order to make sure that he is involving his right hand and not just using compensatory strategies. Currently, Dimitre needs minimal assistance in order to complete upper and lower body dressing. By discharge, it is Dimitre's goal to be completely independent in these tasks. We have progressed him by having him first don shoes that don't require tying laces, then progressing him to using a zipper and snap buttons, to finally being able to button a shirt. Again, our goal is to not make him modified independent. We want Dimitre to have use of his right hand again and are progressing him accordingly. While the main focus of therapy is Dimitre's wrist injury and the issues that it is causing in his hand and fingers and wrist, we still wanted to address some issues with his IADLs. We did this by incorporating IADL tasks that also can be linked to his decreased fine motor coordination, gross motor coordination, and in-hand manipulation. So we've decided to focus on his medication management as well as his meal preparation.
The intervention approach that will be used to address Dimitre's decreased active range of motion and strength would be the biomechanical frame of reference. Preparatory methods that will be utilized include to decrease edema and to perform passive range of motion as well as active range of motion exercises of the fingers, wrist, forearm, and elbow. It is important to remember that the presence of edema can drastically decrease Dimitre's ability to perform functional tasks, especially if it worsens over time rather than improve. Edema can be decreased through the use of compression wrap, ice, and elevation. No application of external heat should be applied to the extremity under any circumstance. The purpose of utilizing the biomechanical frame of reference is to increase passive movement of joint and stretch of involved muscles while maintaining joint tissue integrity and stability, and to increase active movement of the joints during functional intervention activities. It can also be used to reduce swelling of extremity that inhibits passive and active joint mobility. Functional tasks that Dimitre can perform using this approach are upper extremity and lower extremity dressing, showering, grooming, meal preparation, pet care, and functional mobility. If Dimitre does develop tone or contractures in his right upper extremity, inhibitory movements opposite the abnormal tone slowly, holding the stretch until muscles relax, can be performed. To address Dimitre's fine motor coordination and dexterity deficits as well as his gross motor deficits, the task-oriented frame of reference will be utilized. Preparatory methods that will be used include passive range of motion exercises of the elbow, wrist, and fingers, having Dimitre open and close bottles with varying lid sizes, as well as having him transfer coins and paper money from a table to a coin bank. The purpose of utilizing this frame of reference is to improve fine motor coordination and dexterity through functional tasks that involve pinch, grip, and prehensile patterns. It is also used to improve gross motor movements for proper hand placement when performing tasks, as well as to address neuromuscular, sensory motor, and cognitive deficits when performing functional tasks. Dimitre will be responsible for performing his daily occupations independently once he has been discharged from therapy. Therefore, it is important to use his meaningful occupations as a means and an end to achieving functional outcomes during his therapy sessions. Functional tasks that Dimitre can perform when using this approach include buttoning his shirt and pants, zipping his pants and jacket, managing his money as well as manipulating coins, managing his medications via opening pill bottles and placing them in a weekly dispenser. When utilizing the task-oriented approach, it is important to remember that activities should be graded up or down depending on the client's needs. To address Dimitre's decreased memory and vision, the multi-context treatment approach will be utilized. Preparatory methods that can be used include having the patient identify IEDLs that he has difficulty performing or completing, and having him work to develop plans on how to compensate these tasks by either adapting the environment, creating visual cues, or using any other agreed-upon strategies to help facilitate his performance of the task. The purpose of utilizing this intervention approach include to adapt activity or the environment to allow Dimitre to be as successful as possible when performing meaningful tasks, as well as to utilize techniques that can help to either restore or compensate for memory deficits. Because Dimitre is 92 and continues to age, his decreased memory and vision cannot be restored. Therefore, the use of adaptive and compensatory strategies are appropriate. Functional tasks or activities that can be utilized when using this approach include meal preparation, management of his medications, grocery shopping, and caring for his pet bird. When using the multi-context treatment approach, activities can be graded up or down based on how much compensation or adaptation Dimitre needs in order to perform his daily occupations as independently as possible.
Dimitre will be receiving in-home occupational therapy services 2 times a week for 1-hour sessions, and we expect his therapy to last 4 to 6 weeks. It is important to always provide ongoing patient education. We will be providing Dimitre with tips, tools, and techniques in order for him to become independent. It is also important upon discharge that we set Dimitre up for success to remain independent and in his home. Some of the items that we'll be providing him with are references, such as Meals on Wheels, but we also need to address Dimitre's unwillingness to accept help from others. So being able to approach this in a manner where he realizes that he can exchange services with his neighbors, such as getting rides from them while he prepares meals for them or maybe teaches them Russian, then he won't feel like he's getting a handout. We also want to make sure that Dimitre keeps moving his wrists and fingers, as we don't want him to regress. So giving him handouts on how to do home exercises with passive range of motion and active range of motion will be necessary as well.